Now for an overview of healthcare reform and its impact statewide, please make welcome an Ohio State Senator whose district is in the very heart of our region, Senator John Husted.
Well, thank you very much. I have enjoyed listening to all of the panelists so far. It's been informative and educational for me. I do want to say before I start, Happy Veterans Day. I want to say a special thank you to a veteran who's very near and dear to me. He's a 90-year-old World War II veteran named Bob Klaus. And Bob has been in his service in World War II in Korea in 5 plane crashes and survived all of them and is still with us today. So he's the kind of person that when I think of service to America who's contributed greatly, and when I talk to him about those things, he'll always tell me, well, it's no big deal. And he's a truly great person. But you know, those things that the veterans have fought for, you know, as a public servant, it makes me feel a little bit more responsible for making sure that we do with those freedoms that they fought to give us the best that we can. And I think that the discussion here tonight, we can do honor to their service and to the cause of which we are here to discuss if we recognize that we're all Americans, we're all in this together, and despite the fact that we're going to have passionate feelings one way or another on certain issues, that if we listen to one another, if we try to understand where everybody's coming from, we might find out that we're not as far apart as we first thought. My job here, as I was asked, was to talk about the statewide impact, and I want to give you a few thoughts. I thought what Brian Bucklew said was right on the target. We haven't had free market in healthcare in a long time in America, in many different ways, not just from the Medicaid, Medicare point of view, but the insurance plans that exist today are regulated greatly by every state. There are mandates that every state puts on them, and the freedom with which they bring those forward is very limited already. But I think if you look at some commonalities of the discussion that have occurred as of late, the uninsured population is the group of people that we really want to focus a lot of energy on and want to make sure have access to care. Why is that? Yes, I know that some people are uninsured by choice. A lot more aren't. And we need to figure out a better way of helping to provide access to insurance, because we don't deny them health care. If they show up at one of the hospital emergency rooms, they get health care. But that's not a very thoughtful way to cover and provide health care in this country, and we can do better. So we talk about access, the issues like cost, other issues that sometimes people end up being uninsured because of lack of portability of insurance that they have. You know, but people still want choice and freedoms. That's what makes some of them nervous about the public option and the consequences of potentially a entirely government-run healthcare system. And you know, a final issue of pre-existing conditions. You know, the whole concept of pre-existing conditions, something that rightfully has people concerned. But when you talk to an insurance company, they say, well, if you're going to ask us to cover everybody, well, then everybody needs to be buying insurance. The healthy 20-year-old, the healthy 28-year-old needs to be part of that pool too, because that's how insurance works. If you're going to cover everybody, if you're going to expect us to cover everybody, everybody needs to be part of the solution. And that's a hotly debated issue, because then you get into the whole concept of forcing people to buy health care, forcing people to purchase something or be involved in a program that may be against their freedom or their desire to participate. But you know, as I'm looking at the statewide impact, there's one aspect of this that we must come to grips with as Americans and as Ohioans. We have Medicare and Medicaid, which, as Brian Bucklew had talked about, makes up over 50% of the health care of the insured in our population are in one of those two programs. But we also have a national debt of about $12 trillion. We have projections of growing that debt to as high as $17 trillion over the next few years. On a per capita basis right now, we had a baby girl 6 weeks ago. She was born into this nation as her share of the national debt being about $45,000. We have spent ourselves into a position that Medicaid and Medicare are not even going to be paid for in the near future. They will not be solvent in the very near future. You look at the growth of costs for private insurance. That's something that's been very difficult for businesses to deal with. It's one of the things that does make us it makes America anti-competitive. That's why businesses want to come to the table right now in this debate, because many of their competitors in other countries don't have the same costs as it relates to health care. 1980, health care was 9% of our GDP. Today it's 18%, or at least as of 2008. It's a growing cost for families, businesses, and everybody in this country. And I know, that nationally, anytime you turn on the news, it's always the debate in Congress, public option, no public option. And I really do think that that has taken up so much of the conversation and taken away more important conversations that could occur about the other issues that are important. Reform, yes, but the things that have worked, and you talked about tort reform a little bit earlier. I was part of the legislature when we passed that. And, I listened to a lot of physicians. We stood right out there in Dave Hall Plaza with a group of physicians and held a rally because a lot of the OBGYNs were going to leave Ohio. They just weren't going to do it anymore. They couldn't afford it. They were working until June just to pay their insurance bills of every year. And we made those reforms in Ohio. That has helped control costs. It's not something that exists in every state, and it doesn't exist in this plan as it stands right now. But another thing we're going to have to come to grips with as Americans is our own health. If we want to have other people through a government program, whether it be Medicare, Medicaid, or some sort of public option, or some sort of subsidized private option, we have an individual responsibility as Americans. Nobody can get us. Take 30 minutes a day and walk the dog or go out and exercise. Educate yourself on the kinds of things that you need to eat to take care of yourself. These things, if we're asking our neighbors to help us, we should ask of ourselves to make some sort of commitment to improving our own health. And that's something as Americans, we really must come to grips with. A few other things that can occur at the, if you look at the state, the tax treatment and the way that we treat people on, the individual payer doesn't get treated as well as the business payer does on their tax treatment. Allowing multi-state compacts and insurance, that's another way that we could allow larger buying pools to improve the cost of health care for individuals. But I want to close by just talking about a few state numbers. A lot of you probably don't realize that in our state budget, with the federal and state combined, that we spend more basically on Medicaid than we do on K through 12 and higher education in this state. That puts in perspective of how big of a cost healthcare is at the state level. You may think it's all federal, but it's a big deal in state government. At the federal level, there's a 60-40 match for most Medicaid services. They pay 60, we pay 40. Under the proposal that passed the House, that would be a federal proposal for the increase of Medicaid. They want to increase Medicaid eligibility and cover people through that. Initially, that would be 91% federal and 9% state. But what we worry about is that's how a lot of federal programs start. They start by saying that we get you in, we get you going, we reimburse you, but then federal budget, you know, as I talked about, we have $12 trillion in national debt, and so they're going to say, well, the state, now you're going to have to pay 81. Well, now you're going to have to pay 7. You know, now we're only going to pay 81. Then we're going to pay 7. And eventually, it just cycles down where we can't afford to pay for the federal program that they've provided us. So they haven't really provided. If you don't pay for it, you haven't really provided anything. And you know, that's a major concern, particularly when you look at the state of Ohio's budget. That going into the next budget cycle, I don't know if you're aware of this, but essentially we have a $50 billion budget right now. And due to the federal stimulus money that came in and a few other things, of that $50 billion that we're spending on schools, health care, higher ed, and things like that, we only really have $43 billion in recurring revenue. So as we head into the next budget cycle, we have about a $7 billion hole in the state's budget. So when you look at these things from a state perspective, the thing as a public policy maker that makes it difficult is I see a lot of people who are hurting, whether they're businesses trying to pay for health care, families that don't have it, people with pre-existing conditions that can't get covered. We're going to have to come to grips with the fact that this costs money, and we have to pay for it. And that if we don't think through the cost issues, because we can have the best of intentions, but if we keep if what's happened from 1980 till now occurs over the next 30 years, you will not be able to afford health care in America, even if we have a nationalized system. It will become out of reach. And so while each one of you in here has a reason that you're here, there's something about health care reform that means something to you, I would encourage all of us to listen to one another and recognize that we're probably all not 100% right, and that there's something that your neighbor is saying that has to be addressed. And if we can get the Congress, both Democrats, Republicans, and the President to hear what we are saying and to understand the full scope of the problem, I think that America can have its brightest days ahead of it, because we will have come together and solved one of the nation's biggest problems. Thank you.